I started isolating myself. I basically went to work and went home and went to bed. I just didn't have any joy of life. Then about 6 months ago, my wife and I went through a separation. That's when I really went downhill. I lost my appetite. I lost weight.
Dr. Tejinder Sidhu gave Frank a PHQ-9 as part of an overall mental health assessment.
It would seem as though your mood has been quite low and you've been having some trouble sleeping and eating, etc.
Yeah, it's been going on for some months now. I just can't seem to shake it.
There are steps that we can take to help you.
I'd prefer not to take medication.
I don't think that at this time we need to consider medication. There's a new program in British Columbia called Bounce Back. There is also a DVD.
So what's involved in them?
Bounce Back offers a couple of things we might want to consider. The first is the DVD that I've given you, and it has some very practical tips and strategies which are used to combat unhelpful thinking, inactivity, sleep problems, and so on. Then there's a second part to the program, which is a self-help guided program.
Never been that good with self-help books.
A lot of people have problems with that. But this program is different because it involves a community coach who will contact you by telephone and set up an interview with you. She will be working with you over the course of the next 4 to 8 weeks, as much time as you require.
Funded by the BC Ministry of Health and delivered by the Canadian Mental Health Association, the Bounce Back program offers 2 interventions. The first is a professionally produced DVD called Living Life to the Full. It provides a good first-line intervention for depression and an easy introduction to the topic of mental health.
The self-help system in this DVD has really worked for many people with low mood and depression. You'll find out how to solve problems, build your confidence, and start thinking helpfully instead of in ways that backfire. You'll learn how to sort out poor sleep patterns and see some easy ways to get yourself fitter and healthier. And you'll learn how to be more assertive, letting other people know what you want, but nicely.
I took home the DVD that evening and watched it right away and really could relate to a lot of the points that people in the DVD were discussing.
The second intervention is a guided self-help program with Bounce Back community coaches providing telephone support.
This is Jocelyn calling from Bounce Back.
Oh, hi, Jocelyn.
This evidence-based program covers areas such as balanced thinking, problem solving, sleep habits, assertiveness, and others.
So with this program, I would be sending you out workbooks and you would just work on areas that are relevant to your own situation.
I could really relate to the material, and it was simple, easy to do the work that's involved in them, and I got practical value out of them.
So were you able to put the being assertive into practice?
Yes, I used it. I actually used it in my apartment. I had a neighbor that was making a lot of noise.
To get started, contact the BC division of the Canadian Mental Health Association, and they'll send materials and referral forms. Use the forms to activate the process for your patients. The coaches will keep you informed about your patient's progress. They'll forward to you pre- and post scores on the PHQ-9, GAD-7, and the Quality of Life questionnaires. They'll also keep you apprised of the focus of the intervention, in particular which workbooks were used.
It was about 2 months ago that you started the Bounce Back program, and how did that go for you?
Very well. It gave me a track to follow, and with the coach contacting me on a regular basis, it kept me on track and encouraged me to complete the program.
There's been a significant improvement in your mood. Your PHQ score has reduced from 15 down to 5. Also, there seems to have been a significant reduction in your anxiety levels. That's very good progress. What did you get out of the program?
To set my goals in a more reasonable way so that when I achieve them, I gain more confidence. And that's helped a lot as well. In addition, I'm making contact with friends again, and we go do things together.
For your patients with mild to moderate depression, Bounce Back offers a non-pharmacological approach for treatment using proven cognitive behavioral principles. A DVD is one useful intervention, as is the telephone coaching program.
I've referred about 30 patients to the Bounce Back program. Certainly the feedback that I'm receiving from the patients has been extremely positive. The Bounce Back program is particularly good for the patients who are living with chronic conditions and also trying to cope with low mood. It frees up office time and allows me to concentrate on the medical issues. The community coach can then deal with some of the emotional issues.
They do get positive results, so they're very encouraged.
It's done wonders for me. I really noticed the difference. I'd recommend it to anybody who's suffering from low mood or depression.
To get started, contact the local branch of the CMHA. Check their website or phone. They're active partners in helping you help your patients.